Good morning, good afternoon, good evening, depending on where in the world you might be joining us from. We are so excited to have you here today. Today's pre-arrival webinar is going to focus on student health, both including immunization as well as insurance requirements. And we have lots of different partners here and content area experts to answer all these good questions that you might have. So we're so excited to have you with us here today. All right, we're going to go ahead and get started because we want to make sure we have time for all of your questions. So first off, we just want to extend such a warm welcome. It's so exciting this time of year. I know that September feels a far off ways away, but we get to start interacting with our new cohort of international students months and months before you all arrive. So we're excited. It's so fun to start to meet you and to be able to host these webinars, answer your questions. And we're excited for you to join us in our Triton community. My name is Grace Fuller. I use she, her pronouns, and I serve as the Assistant Director of International Experience and Engagement at the International Services and Engagement Office, often referred to as ISEO. And I'm joined by a lot of wonderful colleagues here today who all invite to introduce themselves. So I'll pass it over to Marie.
Good morning, everyone. My name is Marie Monlapaz Rivera. I use she, her pronouns, and I'm the Assistant Director for Student Services at International Services and Engagement Office, also known as ISEO, and I will pass it off to Shauna.
Hello, everyone. Welcome. My name is Shauna Slabiota. I am here from the Division of Graduate Education and Postdoctoral Affairs. We're so happy to have you join us today, and I'll pass it next to Ashley.
Hi, everyone. My name is Ashley. I'm one of the nurses at Student Health Services. And just welcome. Just wanted to say hello.
Hi, everybody. My name is Jill Batika, and I'm the Billing and Insurance Manager for the Student Health Center on campus. And I'll introduce Jerry.
Thank you, Joe. My name is Jerry Hu, CEO of Student Medical Cover, a outside alternative options that students can benefit from. I will hand it back to Grace.
Thank you. So as you can see, we have so many different partners here today, and we're so thankful for them lending their time and their expertise, because I don't know if I could answer all of your questions about immunization and insurance requirements. So thankfully, they are here. Okay, so this is a little snapshot of how we'll spend our time together today. We just have some really important reminders that we always like to kick off the webinars with. Then the bulk of today's session will be dedicated to student health services. So your immunization requirements, as well as your health insurance requirements and waivers. We'll talk about the UC Student Health Insurance Plan, also known as UC SHIP, and some alternative options. And then we'll end with some final upcoming webinars and additional resources. And as always, we do dedicate some time at the end for open question and answer. So a little housekeeping before we begin. As a reminder, you are in listen-only mode, which means you can hear us, but unfortunately, we can't hear you. So the main way that we'll interact together today is through that Q&A feature on your Zoom menu bar. Like I said, we will have dedicated time at the end, but if you're anything like me, sometimes you have a burning question and you don't want to forget it. So you can go ahead and submit that question, and if it's relevant, we'll try to answer it during today's session, but if it's more appropriate, we might save that for the end. And then finally, we are recording. So you'll be able to view this webinar recording as well as all of our other pre-arrival webinar recordings at inewstudentwebinars.ucsd.edu. And this is also the place where you can sign up for upcoming future webinars. So if this is your first Zoom webinar, this is just kind of a snapshot of what that might look like. So again, it's going to be that Q&A feature, that Q&A box. It should pop up an additional box, and that's where you can submit your question. Okay, a little bit about ISEO, or the International Services and Engagement Office. If this is the first webinar you're joining us for, welcome. Our office is here on campus to support our international community at UC San Diego. So we do this through a myriad of services, one being pre-arrival and orientation. So offering webinars like the one today, really focusing on, we know that students start preparing for their arrival months and months before they physically arrive. And so we are with you throughout that process, whether it's answering questions about your visa documents or bringing in campus partners to answer other questions about your student experience. We are also the folks on campus who really support you on how to maintain your status as an F1 or a J1 international student, and we offer advising to that end. And finally, we also offer a number of different programs and events. We really see ourselves as folks who want to cultivate a global community here. And so we try to offer these programs and events to not only bring together different international students and scholars and families, but also domestic students for some of that cross-cultural exchange. A little bit about the populations we serve. Thankfully at UC San Diego, you are joining a robust international community. We serve over 10,000 international students. That includes our currently enrolled students, as well as the students we support who are working after graduation. We have over 2,000 international faculty and scholars. So, those are folks who are working here at UC San Diego. And then over 1,000 international families, including our spouses, our partners, and the children of our students and scholars. But really, we try to work collaboratively with the entire campus. We know that UC San Diego is a very large campus. And so, something you might find is you expect to ask a question in one place and you might get directed somewhere else. And I know at times that can feel frustrating, but we really do have content area experts in different places situated across campus. And so, one of our goals is to have those relationships so we can refer you to the right place to get your questions answered. But with that, UC San Diego gets to serve as a leading institution for hosting both international faculty and scholars, as well as hosting international students for a service population of just under 14,000. And for today's webinar, I always like to take a little bit to talk about our students. So as you can see, we have over 8,000 international students. So you, again, are joining a really robust community. The split is fairly even, around 4,000 undergrad and 4,000 graduate students. And you can see some of our most common majors and academic departments, as well as our top 10 places of origin that our international students typically join us from. But we have over 100 countries represented here at UC San Diego. Again, I know I said this before, but I think it bears repeating. Welcome. You enrich our campus, you enrich our community, and we are so happy to have you join us as a part of our Triton community. And with that, I will hand it over to my colleague Shauna to talk a little bit about some graduate admissions reminders. Never mind, this is still me. So even though today's session will be focusing on student health, I do know that a lot of students still have questions about how to request your Form I-20 or DS 2019. And so I'd just like to remind folks that if you go to inewstudent.ucsd.edu, that has broken it down into a step-by-step process. So you can follow that almost like a checklist to see, okay, I did this, what's my next step? Okay, I did this, what's my next step? So our first two webinars focused in pretty great detail on how to apply for the Form I-20 or DS 2019. And then once you have that certificate of eligibility, the rest of that process and applying for your F1 or your J1 visa. But if you have any additional questions, I would really recommend referring back to this website. It has robust information.
Well, thank you so much, Grace. I'm going to take a couple of minutes to share some reminders from our graduate admissions team. So we have a link here that goes to your application portal. And you're probably pretty familiar with your portal at this point. That's where you filled out your application and you can check on the status of your admission. But I really want to point out a couple of things within the portal. So first is the Statement of Legal Residence form. So this form is not required for every program, but it is required for some programs. And so I really want to encourage folks to go into the portal and see if it's listed as a to-do item. And if it is listed, please take care of submitting that. That is something that you need to submit. And if it's not listed as a to-do, then you don't have to worry about this step. Most students are provisionally admitted at this time, and that just means that you still need to submit some documentation. That could be a transcript, that could be a test score. Nearly everyone is provisionally admitted at this time. You do not have to wait to have your admission finalized before you start your I-20 and your DS 2019 and your paperwork there. So just go ahead and get started on that. And you can be working on submitting your documentation at the same time. So these are two things that can happen at the same time. And in a moment, I'm going to show a screenshot of the portal and we'll point out where you can check to see what admissions documents are still required. And there's also going to be some instructions on how you can go ahead and submit. If you have questions about any admissions questions about your portal or your admissions documents, please email us and our staff is happy to help you. So this is a screenshot of the portal. There's multiple tabs and we're only going to focus on the first two right now. So the first shot on the left side of your screen is what your home page. This is an example, actually, of what a home page would look like. Your home page is going to look different depending on your situation. I do want to point out the section where underneath the your status as accepted, there's information here about items that need to be completed for incoming students. They're sorted into what to do immediately before you arrive on campus, when you arrive. Please check out those links to make sure that you're working on everything you need to work on. And then the very bottom of that section is where you can see what forms need to be submitted. If something still has to be submitted, it's going to have a red X. In this example, the green arrow means that that's been completed and this applicant would not need to still take action on that. And then on the right side of the screen, you're going to see your checklist items section of the portal. The top part's going to list what documents you are required to submit. For this example, you can see that we're waiting on a transcript from the University of Pittsburgh. And then the bottom half of the page talks about how to submit that documentation and your instructions for doing so. I do want to point out any degrees that were earned outside of the United States do have to go through an accreditation. Usually that's WES or another company, but you would be able to find this information in your portal. And again, if you have questions, please contact gradadmissions@ucsd.edu and they will be able to help you out there. And that's it for me.
Hello, everyone. And I just wanted to say congratulations on your upcoming admission to UCSD. And again, my name is Ashley, and I'm one of the nurses at Student Health. And I'm here to let you know how to achieve compliance with UCSD's incoming health requirements. And most importantly, to let you know that we're here to help you. Our health requirements are done to reduce the likelihood of vaccine-preventable disease outbreaks from occurring on campus. The nature of campus life includes contact with large numbers of people, therefore the risk is increased. So having high levels of immunity in the campus community offers protection to those that are vulnerable to disease. The University of California in 2016 mandated that all incoming students complete TB screenings and prove immunity to certain vaccinations as recommended by the California Department of Public Health. And those vaccines can be found on the screen. Those vaccines include Tdap, MMR, varicella, and meningococcal. And we also have a COVID and flu vaccine requirement that's in the fall and the winter. You can find all information on UCSD's requirements on our website under the Health Requirements tab. And this is what the website looks like. You can start the process by logging on to your student portal on My Student Chart. But please note, you must have an AD login, which is an email and password, to access My Student Chart. Once you have activated your My Student Chart, you can find the incoming requirements on the landing page. Go to Health and click on Immunization/Screenings, or you can click the other links that you see on the slide above. Once you arrive, this is what the page will look like. And you can start by clicking on the green action buttons that are next to each requirement. Here are some helpful tips to help you complete the requirement. Gather as many vaccine records as you can, or use our immunization form found on our website to help guide you. You may also visit your healthcare provider to have the immunization form filled out and to help you fulfill any missing vaccines or to get any blood titers. Please remember the deadline is July 14th and start as soon as you can to prevent enrollment holds. Thank you so much. Here is what the screen will look like. It will ask you to put the dates in for each vaccine that you receive. We also have a tuberculosis screening requirement that all students must fulfill. You have to go on and start that assessment, and whatever the assessment says will tell you if you have to do a TB skin test, TB blood test, or chest x-ray. And you can upload your results in the same place that I showed you earlier on our website where the start button was. You may also communicate with the nursing staff via Ask a Nurse, and we can help guide you in this process. And again, that deadline is July 14th. Here's ways to get help. You can reach out to us on Ask a Nurse, which can be found on my student chart. You may also email us at all of the sites listed above. And please check your My Student chart from messages sent from the nursing team on a regular basis.
Hello, all. So happy to be here to provide some important information about our health insurance requirements today. My name is Jill Batika again, and I am the insurance and billing manager here at the Student Health Center, and I work with Ashley. So, health insurance is essential in the United States because healthcare services can be very expensive without it. Even routine medical visits, prescriptions, or urgent care visits can result in significant out-of-pocket costs, meaning you're paying a lot. More serious medical situations, such as hospitalizations, surgeries, or emergency treatment, can cost tens of thousands of US dollars. Health insurance helps protect individuals from these tens of thousands of dollars of high costs by covering a large portion of your medical expenses and ensuring access to necessary healthcare services. In order to protect our students and our campus, the University of California Office of the President mandates that all students enrolled or registered have comprehensive health insurance while attending our campus. To do this, they instituted the UC SHIP plan, which is an acronym for the University of California Student Health Insurance Plan. This plan is only sold to UC students in California. The plan was built for students with students actively involved in its design. UC SHIP provides high quality, affordable, and convenient coverage that protects students from unexpected healthcare costs. All UCSD students have access to the student health and counseling and psychological services on campus. If you are referred to an outside provider, you will use your UC SHIP coverage to access specialty care. We'll talk about those students that need to waive the requirement because they have another insurance that meets our waiver requirements in the next slide. Students seen at Student Health are categorized with one of the following three payer designations. They're either on our UC SHIP plan and we'll bill that insurance for them, or they've picked up a RAFT, meaning they've successfully waived out of the health insurance requirement, or they're fee for service or cash paying as they go. Students that are seen with the UC SHIP in our clinic don't have to pay anything out of pocket. That's all billed to the insurance company. Students that have our RAFT membership pay a $70 membership fee per quarter in order to receive scheduled appointments, x-rays, and lab services at no additional charge. If you need to go outside of our clinic, then you would use your own insurance for that. Students seen on a fee-for-service or cash-paying basis have to pay for the bill when they're here at the time of service. If they don't, it will be transferred to their student account where they can pay it later, and we'll be happy to provide all of the paperwork necessary for the student to seek reimbursement from their own insurance company. Every registered student at UC is charged a health fee, and you will be automatically enrolled in the school insurance unless you successfully opt out by filing a health fee waiver. Students that come to student health with UC SHIP pay nothing except prescription copays, and those are usually $5, $10, and $40. Students with our RAFT program, which stands for Reduced Access Fee for Tritons, meaning that you have filed a health fee waiver and you've opted to have a RAFT membership, pay nothing for appointments, lab work, or x-rays. And students that access our clinic on a cash paying basis pay for all services rendered. One appointment at the student health clinic as a fee-for-service patient can equate to about $200. So I strongly encourage you to take a look at our RAFT offering. And please file a health fee waiver with your own insurance during the open timeframes on the Triton link, which for the fall will be August 3rd, 2026 through September 11th, 2026. We don't accept late waivers or retroactive waivers, so it's very important that you follow the time frames. We know that insurance is very expensive. So for our international folks, we do have some plans that we will accept on the waiver. If you do want to take a look at these three plans, they are accepted for the health fee waiver. That would be the ISO Care Plan, PSI Platinum Plan, and Student Medicover. And Jerry's going to be talking about that after I finish. If you do need assistance in picking a plan or considering any options, please contact us and we'll be glad to help you with those decisions. On this page, I've given you some quick QR codes so that you can access more information about our UC SHIP program, our student health clinic here on campus, the waiver process, and what the RAFT offering will provide. Our student health clinic is comprised of more than 30 medical doctors, nurse practitioners, registered nurses, and we have an x-ray unit, lab services, a pharmacy, an urgent care, optometry. We provide vaccinations, travel record review, and much more. Please visit our website to get further details. And just so you know, 52% of our students that are enrolled at UCSD do accept the UC SHIP plan. Their primary care physicians are housed at the student health clinic, so they always start their care here at our student health clinic. If a student needs to be referred off campus, we'll gladly provide a referral. And then it's up to the student to pick which level of care and payment they'd like to tap into for those referrals. The student health clinic is open 8 to 4 p.m. most days except Mondays when we stay open a little bit later until 6 p.m. And we are open on Saturdays from 9 to 12 p.m. for urgent care services. We have a nurse advice line for any service questions after we close. Anyone can call our number to get advice from a registered nurse. To make appointments at our clinic, please use My Student Chart or call us at the number provided. This is a picture of our current office found on Library Walk, centrally located on campus. We will be moving to a new center, and that will be in July. And it's about a quarter of a mile from where we exist right now, but still in the center of campus. Physicians can see students the same day or as scheduled. Accessibility is much better than trying to tap into a doctor out in our communities. In an effort to be ecologically minded, the insurance plan does not mail out hard copy insurance cards. Your insurance card, if you choose to be covered by UC SHIP, is found on an app. The app is Sydney Health. Download the app to your phone and you'll have access to find providers, look up and review claims payments, and it'll also provide the front and back of your insurance card. The app will be effective after the first day of coverage. This school year for the fall would be September 21st, 2026. The UC SHIP insurance plan is underwritten by Anthem Blue Cross PPO. That's a provider organization that you can tap into and make decisions with a lot more versatility than being locked into one doctor and one network. Anthem Blue Cross has one of the largest networks in the United States, serving nearly 41 million members. And in California alone, its network includes over 100,000 doctors and over 400 hospitals that you can utilize. The network also includes out-of-country coverage under their Blue Card program, so you can take that trip or go home on break and know that you have global coverage. This is a student division offering only for the University of California enrollees. This plan is considered a Platinum Plus plan under the eyes of the United States Commission of Insurance. Depending on what tier of coverage you would like to use, you can determine how much you'll pay for services. There are 3 tiers of coverage, the UC and Anthem tiers covering the most. If you are seen at a student health clinic on campus and receive a referral to access care at a specialty office or have a hospital-based test, you get to choose where you'd like to be seen. The first tier is the UC providers, meaning any University of California provider or facility in the state would be the most cost-effective to go see. It's a $10 copay to see a specialist and a $5 copay to see a mental health provider at the UC programs, and 90% coverage for any hospital-based service. The second tier is the Anthem Blue Cross network. Using the second tier of benefits means that you're not going to a UC provider or facility, but you're seeking care at an Anthem Blue Cross contracted provider. You can find providers by calling Anthem or using the app Sydney, or you can also go on their website at anthem.com. This requires a $500 deductible for hospital-based services, and it's a $20 copay to go see a specialist under this tier. And then we have the out-of-network tier, which we strongly discourage because that requires a $1,000 deductible be paid first, and then services would be covered at 60% thereafter. UC SHIP gives enrollees a supplemental curative dental plan provided by Delta Dental PPO. Delta Dental will provide UC SHIP members with $1,000 worth of coverage for teeth evaluation and cleaning, fillings, x-rays, root canals, and tooth extractions if you utilize their network of providers. To find a provider, you would contact their 800 number or go to their website. You plug in your zip code and they'll give you a list of dentists in the surrounding area. We don't have any dentists on campus, and a referral is not necessary to access dental care. UC SHIP also covers one routine eye exam, and Anthem iMed will provide you with $120 to apply towards frames and lenses or contact lenses once per benefit year. To maximize your benefits, you would call the UCSD Student Health Optometry and schedule an appointment. If you want to find outside providers, you can contact them at their 800 number or again go to anthem.com. And again, no referral is required for vision. On our UCSD campus, we are lucky enough to partner with over 50 psychological providers and counselors. We refer to them as the Counseling and Psychological Services Program, CAPS. Please call the phone number provided or take a look at their website to find out more about our providers, online resources, and events happening that might be attractive to you. Services at CAPS on campus are free to all UC students. If you would like to be referred to an outside therapist or doctor, please contact CAPS and they'll walk you through the process. Now, some resources you can take a look at for when you're on campus and need assistance. You can, again, always contact us with any questions you might have. There's lots of information here and resources for our clinic, CAPS, the insurance carriers, and when you can do a face-to-face meeting with our insurance staff through Zoom. We also hold webinars and info sessions over the summertime, so please check out our website and register for anything that you might be interested in. Thank you for your time today, and if you see me or any of our staff on campus, please say hi. We're here to help you in any way you need us. You can connect with us also through Facebook, Instagram, and YouTube.
Thanks, Jill. What a wonderful team. My name is Jerry. I'm the CEO of Student Medicover. I've been know Jill's team and working with UCSD students since 2016. With assistance from her office and ISEO, we were able to save insurance costs and provide provide a concierge service to UCSD students. I'm honored to be here providing an alternative option to UC Ship, which can save you thousands of dollars while still delivering same comprehensive coverage. As appreciation for the invite from ISEO, we are offering a free emergency care kit mailed to your door or dorm at zero cost. This is a example of the care pack that we're sending out to all our members. Simply screenshot the next slides for our concierge service team contact information and provide us your UCSD email address to claim your free care pack. Next slide, please. I'd like to share a little bit of who we are and why we are passionate about supporting UCSD students. We partner up with United Healthcare, the largest insurance company in the States, with UHC PPO networks. Will give you access to top-tier care in the La Jolla area, such as UCSD Medical Center and another 1.3 million of in-network providers within the US. Our team consists of former international students, including UCSD alumni. We know navigating healthcare in a new country can be very overwhelming. That's why we offer 24/7 multilingual support and step-by-step assistance with claims, network providers, and emergency situations. Our team is specialized in guiding international students through the waiver process. In 2025-26 academic year so far, we have served 1,200 UCSD students, successfully saving them thousands of dollars. As a graduate student, you can save up to $5,000 per year. Our rate is very competitive if you are under the age of 27. Our most popular plans cost just over $300 per quarter if you are under the age of 25. We also have plans with zero deductibles options to students with the needs and saving money while keeping you very well protected. Don't just as Jill mentioned, don't wait until the last minute. Mark your calendar of September 11th is the deadline for filling out the UC Ship waiver. If you wanted to learn more about us and want the free emergency care kit, screenshot this page and send it to our customer representative with a UCSD email address, and you can claim your free care pack. And thank you. I will now hand it back to the ISEO team.
Thank you. Thank you. Covered a lot of great information, and they'll stay on for questions at the end. So I've seen a few questions already come through the Q&A. Please continue to submit those questions because this is the time that we have the people dedicated to answer those. But first, I'm going to talk about some ways that you can get engaged during your time here at UC San Diego. So, we have created a couple of guides meant to support you through your pre-arrival season. The first one is our welcome guide. The welcome guide is filled with checklists for you to do right now, for you to do as you prepare to arrive, and for you to do upon arrival. We know that a lot of this information can feel overwhelming at times, and so the guide puts it all together in a little bit more of a digestible format and allows you to kind of check things off one by one. So thank you to Marie for putting that link in the chat, and you can access our welcome guide there. The second guide I want to highlight is our Surf Check Guide. Our Surf Check Guide was created for students by students, specifically addressing the most common questions students have as they prepare to transition to UC San Diego. So this covers topics like how do I arrange transportation from the airport to campus? How do I set up a phone account? How do I set up a bank account? All of those life things that come with moving to a new country to start a new chapter of your life. So thank you again. You can check out that link in the chat, and I'd highly recommend this resource. Our Grad Pals peer mentorship program matches incoming international graduate students with current graduate students at UC San Diego. This is one of the programs that students say was most helpful in their transition to be able to ask questions of a peer and be able to just kind of have a little bit more of a um, less formal way to ask all of your questions can be a really helpful resource. So I'd highly recommend you checking out our Grad Pals program. Finally, we have signature programs that we often refer to as I programs. These programs typically happen monthly during the academic year, and it's a way for our community to connect to one another and start to foster that home away from home. So if you're curious, you can visit iprograms.ucsd.edu to learn more. And then as a complement to iPrograms, we also have our iEvents calendar. So our iEvents calendar is actually a live calendar where you can find the actual date, time, location for upcoming events. Many students will bookmark this page, and whenever they're curious about what to do that weekend or that week, they'll take a look at iEvents to see the different events that might be happening. And then finally, we invite you to follow us on Instagram. If you're kind of curious about what your life at UC San Diego as an international student might look like, our Instagram is a great snapshot into that. So we feature different international students as they go about their daily life and give you a sneak peek into their favorite study spots, their favorite things to do when they're not in lab, and kind of that holistic experience. Okay, so here are some final reminders before we shift to our Q&A. There are a few things that we would highly encourage you to do now. So one, as you're able, you can begin requesting your visa documents via iServices. I know we have experienced some delays with the new Triton student system. So thank you in advance for your patience for those of you who might be experiencing those delays. But once you can, just like Shauna said, please don't wait, start that process. The other thing you can start doing is applying for on-campus housing. Housing in San Diego can be really competitive. Last week we did have a webinar about housing, and we hope to have that on our website soon. But that's a process that we would always encourage you to start sooner rather than later. As Ashley mentioned, July 14th is your deadline for those health immunization requirements. So you can visit Student Health to learn more, but that's an important time to keep in mind. And then in September, lots of things happen. So we have move-in and check-in and tuition and orientation. So it's usually when we actually get to meet you face to face after interacting virtually for all these months. We have a few upcoming pre-arrival webinars that we want to make sure you know about. So this Thursday, we have our partners going to talk about graduate student funding. So there's a lot of ways that international students fund their program and different packages. And so if you have questions about that, I'd highly recommend that webinar. Next Tuesday, we'll talk about English language requirements for instructional assistants. So if you're curious about being a teaching assistant or a TA during your time here, or an IA, an instructional assistant, or a GSR, or graduate student researcher, there may be some English language requirements associated with those positions. And so we'll get into more details on what those are on March 24th. March 26th, we'll talk about student life and getting involved on campus. This will be your chance to hear from current international graduate students about their experience at UC San Diego. And then April 16th, we'll have finances and student accounts. April 23rd, campus safety. April 28th, getting set up in the US or our Surf Check Live. And then May 5th, talking about the CBIS transfer process. But as I shared before, all webinars will be recorded and posted, as well as signing up for new webinars at inewstudentwebinars.ucsd.edu under Fall 2026 pre-arrival webinars. Okay, so with that, we can start to transition to our open question and answer. So we've had a lot of good questions come through the Q&A. And so I'll go ahead and start with our first question. So this question reads, for students who might have deferred from fall 2025 to fall 2026, is there a different process for health immunization requirements? Ashley, can you speak to that, or would you recommend that they contact your team?
Hi. As far as deferred students, it's probably better that they recommend the team because I'm not quite sure how being deferred changes the process of the immunization requirements and the deadlines. I'm not quite sure about that. So I would recommend that we reach out to probably Annie when she returns for deferred students.
Wonderful. Thank you so much.
Welcome.
Okay. Our next question reads, Student MetaCover offers multiple plans. Which one is recommended by UCSD students that matches the most deliverables or requirements? Jerry, can you speak a little bit more to that?
Yeah, sure. Short answer to that, we work with the jails team and also the UC system to making sure the policy that we are offering to students meet the requirements. So basically, you go to our website and type UCSD. The pre-approved plans will be showing up. That making sure that you are covered uh, under a qualified plan. But however, I guess the student is also asking, whether or which plan is best for his needs. I would highly recommend the students to consider that and also contact our concierge teams to be able to, figure out because insurance is a complicated topic which I could not to speak in a general. Do highly recommend students to consider now and consult with our concierge team.
Thank you,
If I can
Jerry.
add to that, Grace,
Please
if
do.
you do have a personal or a confidential medical situation, please don't share it here. But if you do want to contact us and ask any questions, please either visit us through Zoom, email us at ship3@ucsd.edu, or give us a call and we'll be glad to assist you.
Wonderful. Thank you. That's a great recommendation, Jill. Ashley, many questions are for you. You're very popular. I see you're busy answering one of these questions, so I hope not to overwhelm you.
No, not at
Um,
all.
is there a question that you would prefer to start with?
I can actually I was typing one out, so if I'll just probably just say it better. That way I can just get. So this is the question that it says, thanks for the session. I have one question. It's about vaccine medical test proof that we need to submit. How old can it be? I had my, in May, which included a quantiferin. Will that work? So the TB testing has to be done 1 year prior to admission. So typically, if admission is about the fall of 2026, then it has to be from the fall of 2025 to the fall of 2026. It has to be current in that way. For vaccines and immunizations, obviously, those can be from childhood. That doesn't have to be within the past year. But for the TB requirement, yes, it has to be within um, 1 year prior to admission.
Wonderful.
And it looks like here's another one. It says in the website, I see influenza vaccine as a requirement. However, I do not find the influenza vaccine in the requirement PDF. So that one is not able to be accessed until it's flu season. And so that one is locked and probably until about fall. And then when the fall comes, typically, usually it's about August 1st for that one. Then you'll be able to put in the flu vaccine. But right now, yes, it will be locked until the next flu season begins.
All right, we were able to get through. Oh, we have another question. So this question reads, are the full set of x-rays and tests always required, or does it depend on certain factors on the questionnaire?
So I know it does say on their TB skin test, and it says TB blood test, and then it says TB chest x-ray. And so the TB chest x-ray is only to be done if it's indicated by following the instructions on the paper. So you'll see the form, and then the form has like a tree of things. And so it will only be indicated if it's indicated. But if a TB x-ray is indicated, you must turn in a TB chest x-ray report. And that is an interpretation of the x-ray. That is not the image. The image will not work. We need an interpretation from a radiologist for that requirement.
We'll allow a couple more minutes for folks to submit any last burning questions they have. But during that time, I might invite our presenters to put in the chat any preferred communication methods. If students have any follow-up questions, what is the best way to reach out to you and your team? And that way We will try to get, again, as many questions as we can answered here today. But we know that sometimes that question comes to you a week later. And so we want you to be able to connect with our campus partners and our experts here today in the future as well.
And also a reminder that this session is being recorded and will be posted on inewstudentwebinars.ucsd.edu. So if you also want to revisit any of this content that was presented, you can also look at the recording if you want a little bit of a reminder, perhaps, of what was discussed.
Yes, thank you, Shauna. And for those of you, I know we had some questions about previous pre-arval webinars. Those recordings are in the process of being edited and posted. So we usually ask about 1 to 2 weeks before it's available on our website. So if you are able to join us live, that's always the best case scenario. But if for some reason you missed a previous webinar, give our team about 1 to 2 weeks, and then you should be able to access the webinar recording then. And I'll also put our contact form for our team. So if you do have any questions about, let's say, your Form I-20 or DS 2019 or applying for your visa, you can submit those questions via the ISEO contact form. Okay, I haven't seen any new questions come via the Q&A in the last few minutes. So I think we can go ahead and wrap up today's session. So I just want to, again, extend such a warm thank you to all of our presenters here today. Truly, we could not have done this without you. We are not experts in these fields, and so we're so appreciative of you lending your time and expertise with our community and supporting our international students as they transition for their time at UC San Diego. So thank you. Thank you to our students who joined us for how engaged you are and asking your good questions. And we hope you have a great rest of your day or evening, everyone. Take care.